Good evening, everybody. I am presenting today the important instrument for the rapid treatment of amblyopia. Next slide, please. Santhan's Magnacellular Stimulation. Now, amblyopians, what we did was we took a group of patients with amblyopia and strabismus between ages of 6 and 55 years and treated and followed up with orthoptic for at least 6 months, many of them for over a year. And improvement was noticed in stereopsis, in binocular single vision, monocular vision. And I'll show the data at the end of this talk, where the improvement in all these persisted even after 12 months of stopping the treatment. And stereopsis improved more rapidly than the vision in amblyopic eye, and most patients reached up to 40 seconds of stereopsis in about 15 days' time. Next one, please. Let's move on. Now, the indications for this use of this instrument, it's from the Carditech Medical Devices Limited, private limited company. It is used for amblyosias of all types. It can be used for treatment of intermittent and consecutive exotropias, which get cured without any surgery. It can be used in some type of estropias and they don't need surgery. It can be used in manifest dissociated vertical deviations. It can be used in sensory fusion disruption abnormality due to any reason. It can be used in treatment of some types of nystagmus which get cured completely. It can be used in acute acquired nerve palsies, either 6th or 3rd, which recover much more rapidly, although some of them recover on their own in 3 to 6 weeks' time. With this instrument, they recover in about 10 to 12 days' time, much faster than what they do. And it can be definitely used in attention deficit disorder in the young, and it improves their concentration and their comprehension ability in the class. It can be used in cerebral palsy and the associated motor incoordination, which improves significantly following treatment. And nowadays, a few papers have started appearing where a similar type of thing has been done in Alzheimer's syndrome, where a significant improvement has been noticed. So these are all the indications. But where we don't want you to use is in our structural abnormalities in. Now, how this system works, I don't want to go into the details because I'll be here for the whole day. Just suffice it to tell you that occipital cortex is connected to all parts of the brain, and in turn, it receives impulses back from the various parts it is connected. And this is what is called as top-down impulses. And we use the presence of these top-down impulses to circumvent the suppression which is present in the occipital cortex at level 4C beta. Next one, please. Just move on to the next one. So I don't want to go into the details of these connections, how it is thought about, how we made this machine, etc. But it depends on the existing connections in the brain, and the occipital cortex is connected to all parts of the brain, and also it receives impulses from all parts of the brain. The most important point I would like you to note is in the attention area here, and this attention area is what we make use of in this machine. Next one, please. Just move on to the next one. Now, we treated a group of patients, about 35 patients I have calculated, but right now I have more than 100 patients treated with this. We analyzed the stereopsis, which was present in only 3.57% of the patients before treatment, and it was present in 92.86% of the treatment patients after treatment with SMS. And this improved within 10 days. Next one, please. And the squint. This was a surprising finding for me. We noticed that only 25% of the patients before treatment had orthophoria. But after treatment, we noticed that nearly 70% developed orthophoria following the treatment with this machine, which was very surprising, but can be easily explained as to why this happens. And this is also the reason why nystagmus improves in many of these patients. Next one, please. And we noticed that both binocular vision improved significantly in these patients for distance. See, binocular vision for near is seen in stereopsis, but binocular vision for distance can be seen either using the red-green glasses or using, if you have, the stereopter for the distance. That is Manto. That's very expensive. We are trying to devise another stereopsis machine for the distance using the color vision. So it improves in 92.86% of the patients following treatment. The distance vision binocular vision improves. And this is what helps in the improvement of intermittent divergent squint, where the deviation cannot be controlled no matter what you do with convergence exercises for distance. So we use this machine and control the deviation for distance very easily. Next one, please. So binocular vision improves. This is how the machine looks like. It has got 3 rows of LEDs, lights which come on at different speeds. And depending on how they use it, we stimulate both the covert attention and overt attention. And we also stimulate the hand-eye coordination, giving a laser light. Next one, please. Because of that, many of these children, they notice that the handwriting improves phenomenally in these children following treatment. Now, we compared a subgroup analysis between anisometropic and strabismic amblyopia, and we realized that both improve equally well, and there is not much of a difference. Next one, please. The male-female ratio is the same. Age of the participant is more or less the same. And BSV as presentation, you can see that none of them had any BSV at presentation. But soon after treatment, next one, please. Just keep moving this fast. Soon after treatment, you notice that 100% of the patients with anisometropic and about 90% of the patients with seborrheic amblyopia had binocular single vision after treatment. Next one. Initial visual acuity, you can notice that 0.493 in anisometropic and 0.210 in strabismic amblyopia. It's pretty much the same, not much of a difference, and that's why p-value is 0.02. But post-treatment, you can see that the visual acuity in both these cases. Next one, please. In final visual acuity in both these cases, you can see it has improved up to 0.08 in anisometropic and 0.07 in strabismic, which is not much of a difference because both of them improve very well following treatment in monocular vision. Next one, please. So you can see the initial stereopsis was 0. See, there was no stereopsis, but we cannot call it 0 because 0 is a good stereopsis. So we put a figure of 3000, although they had no stereopsis. And it is pre-treatment. And there was no difference. Both of them had very little stereopsis. Next one. Before the starting of treatment. And post-treatment, you can see anisometropic amblyopia improved rapidly to 45.4, whereas the strabismic amblyopia improved to 216. But they need some more treatment. The strabismic needs a little bit more treatment, and also they may need surgical correction to bring it to normal stereopsis. Next one, please. So you realize that the mean refractive error is slightly higher in the anisometropic, obviously, compared to strabismic amblyopia, but both of them had refractive error, which is more or less comparable. Next one, please. So number of treatment sessions is pretty much the same, 16.2 and 15.8, depending on the age. Younger age group improve much faster than the older age group. They need about a week's treatment and they will be normal, particularly the bilateral ametropic amblyopias. They improve very rapidly. Within 4 days, they become normal. Next one, please. So this is all the statistical comparison of various types stereopsis by Wilcoxon matched pair test. You can see that it is improved considerably post-treatment, and binocular single vision is also improved considerably post-treatment. And most important point was the monocular visual acuity improved. Even in a patient who is about 50 years old, it improved significantly after treatment, but they needed slightly more sessions compared to younger patients. And the most important point is that many of the patients became orthophoric. So I believe strabismus is a problem not of the muscles, but it is a problem in the central nervous system coordination in the parietal lobe, which is called as the global motor sensory integration point. The parietal lobe treatment problem leads to all these things, and there are many articles nowadays which are appearing which say that attention center which is present in the parietal lobe is what is the problem, and amblyopia is considered as an attention deficit disorder. I think I'll stop.